All righty. Welcome, everybody. Thank you so much for joining our Advanced Directives lecture. I'm Jasmine Chandy, the program coordinator for Rush Generations. Thank you to those of you who've joined in, whether you've joined online on YouTube or if you're joining in over the phone. I am going to go ahead and get started with just ground rules and talking about how this is going to work. And then I'll introduce our speakers and we'll get started. All right. So first and foremost, throughout the lecture, if you have any questions for our speakers, for those of you who've joined in on YouTube, there is a live chat button. So you can go ahead and press that live chat button. It'll either be on the right side of your screen or the bottom of your screen. And over there, any questions, any comments you have, go ahead and type that in throughout the lecture. And then at the end of the lecture, I'll go ahead and ask those to our speakers. So for YouTube, you can go ahead and find that live chat button. It'll be either at the bottom of your screen or to the right side of your screen. For those of you who've joined in over the phone, at the end of the lecture, when we do Q&A, there will be an opportunity for you to unmute yourself and ask a question as well. All right, and for those of you, if this might be the first Rush Generations lecture you've joined, welcome. We're happy to have you. Rush Generations is a health and wellness program that's all about aging as best as we can. So we offer lectures like this one 2 or 3 times a month. We also have workshops and exercise classes, support groups, tons of great programs. So we'll share a little bit more about some of our upcoming programs and how you can learn more at the end of this lecture. All right, so we'll go ahead and get started with introducing our speakers. So first we have Dr. Bednarczyk. Dr. Bednarczyk is a dually board certified physician in family medicine and geriatrics. She is the current section chief of geriatric medicine at Rush, along with serving as the medical director for the Rush Senior Care Clinic. In addition to her responsibilities, Dr. Bednarczyk is involved in helping Rush become an age-friendly health system and is also the medical director for the Center for Excellence in Aging and the Senior Care Clinic. Next, we have Aoife Lee. Aoife is the Director of Chaplaincy Services and more at Rush Oak Park Hospital. She has her doctorate in ministry from CTU and has published in the area of advanced care planning. She has worked in the Rush system for over 20 years, primarily in intensive care units with both patients and families, which has led her to see firsthand the importance of discussing one's values and healthcare interventions before something happens. So we're really happy to have both of these speakers with us today. They have a ton of expertise and experience, so we're really grateful for both of you. And we'll go ahead and get started with Dr. Bednarczyk.
Wonderful, thank you. I think I speak for everyone when I say that I'm very excited to be here along with Aoife to really speak about this really important topic. We are going to move on to just a quick overview of our objectives, which include discussing what is an age-friendly health system and how does that influence our conversation today, centering around advanced care directives and discussing why everyone really should have an advanced care directive for themselves, including a healthcare power of attorney. We will review the different types of legal documents that are available to document our wishes, and also review different resources that are able to help stimulate this conversation, not only with our medical team, but also with our loved ones and caregivers. Next slide. So what is an age-friendly health system? An age-friendly health system is meant to ensure that regardless of the healthcare setting that the patient is in, whether it is the community, clinic, hospital, or the nursing home, acute rehab setting, that patients receive equally excellent and evidence-based care, looking at ways to decrease associated harms with the healthcare system, and that really we are providing care that is consistent with their own wishes. The age-friendly health system means addressing the 4Ms, and you will be hearing this term pretty frequently if you have joined previous lectures, or hopefully will join lectures that will be coming up in the next couple of months. Next slide. So what are the 4Ms? The 4Ms is a framework of an age-friendly health system. This is an initiative that has been developed by the Institute for Healthcare Improvement, the John A. Hartford Foundation, the American Hospital Association, and Catholic Charities, among other partners, to really distill best practices for older adults into the 4Ms. It is hopefully an easy phrase to remember, which really looks at addressing what matters, the most important M, mobility, medication, and mentation. And so today we are definitely going to be talking about the what matters piece here. Next slide. Raj is very honored to actually have been named the first age-friendly health system in all of Illinois. And really it goes along with the belief that we really want to provide excellent care to all of our patients across the entire lifespan, and also looking at the care that our older adults receive. So the 4Ms really means good care. We want to be able to identify the core issues that really influence the care that our patients receive and the decision-making that it needs to be involved. It is a way to help organize care, especially for patients that are living with multiple chronic conditions, where sometimes it might be very challenging to address competing healthcare needs or different changes in their medical situation status. It is really a way to be able to focus on the well-being and the strength of the older adults. We really want to be able to see each older adult as an individual and not just the list of all of their symptoms and their medical diagnoses. And so if we find ourselves in helping to utilize the 4Ms framework in providing the care for older adults, we find ourselves that we are not just addressing one M. When you start looking at addressing one M, the other ones fall in line too, and all of a sudden we find ourselves drawing in the other 3Ms into the conversations because they are very much interlinked together. And so we really want the 4Ms to really set this framework for providing care for every individual across the lifespan, across different settings, and in every interaction that they have within Rush. Next slide. Next slide, please.
One moment, it's not progressing. One sec. All right, let's try this again. There we go.
Next slide, please keep going through the slide. So ultimately, when we are addressing the 4Ms, the question really is, as the ultimate M, in terms of what matters to you as the older adult. And so when we think about what matters, it really is thinking about how does this apply to each patient's individual health and well-being. And really we want to know, when we are addressing the 4Ms and the what matters piece, how does this influence the way that our patients interact with the healthcare system? And ultimately, are we providing the care that patients wish to receive? Also, answering the what matters question really has a significant impact on influencing how physicians and their medical team and other healthcare providers really look at addressing advanced care planning with our patients. Next slide. Why is this important, and why are we talking about advanced care directives? It is because we know that older adults are at risk for having an end-of-life situation that perhaps might not have been consistent with their own personal wishes. We are finding that nationally and even within our own healthcare system currently, there are some pretty low rates of conversations that patients are having with their medical team in terms of what's important to them. Many patients do not have that healthcare power of attorney or advanced care directive. And ultimately, when we find ourselves in a situation where that information would be beneficial to the patient, we're needing to guess what the patient would want for themselves. And families at times can be struggling to make that decision for themselves without having that conversation. Next slide, please. So we know that most individuals and our most older adults from national surveys prefer to be able to pass away at home, surrounded by their loved ones in comfortable and familiar surroundings. And yet we know that only about 30% of the patients have an advanced care directive expressing their wishes for their end-of-life care. So there is much more work that needs to be done around this. We also know that even if our patients have had an advanced care directive that they have completed, more often than not, their medical team and their primary care physicians are not aware of its existence. Next slide. And so that opportunity of making sure that we can provide care that is consistent with the patient's desire and preferences, really, we don't have that opportunity to have that. We know that the healthcare system can be quite complex and challenging at times to navigate. Sometimes we find ourselves with time constraints where acute medical conditions need to be addressed, or that our care team is trying to address and make sure that the chronic medical conditions that our patients are living with are well managed and their needs are addressed. And then we are also finding that actually patients really don't really understand or are aware of the impact that these types of conversations need to happen. And so this is also a way to help empower our patients about the fact that it is very much okay to be proactive, to have those conversations with our loved ones and with our healthcare team about what's important to us, and to really sort of plan for the best case scenario and also that worst case scenario. If I am at the end of life, if I've received a significant life-changing medical diagnosis, what's important to me? How should we move forward? That guidance can be extremely important and beneficial, and especially to you as the patient, making sure that, again, we're being consistent and thoughtful about the care that we are providing while keeping your wishes in mind and at the foremost of the majority of our decision making. Next slide. And so again, in terms of the benefits of having this kind of a conversation, it allows us the opportunity as medical professionals to really be able to address any questions that might arise, or again, making sure that we are able to respect our patients' wishes. Everyone is different. The things that they hope for and wish for are different. And so just like we wish to see our patient as individual members and not just as a patient and a number, we very much want to be able to provide that individualized care for them. There's a lot of studies that have shown that by completing those advanced care directives and having that conversation about what's important to the patient, it really can help improve their quality of life. Additionally, in times of medical crises, when patients are not able to have this conversation and make decisions for themselves or really express an opinion or a preference, and that conversation has never been had before, it can really cause significant distress for their family and their loved ones and caregivers. And so, having this conversation when it's not a matter of urgency, of having to make a decision very quickly because there is a medical emergency that needs to be dealt with, it can really help to decrease family and caregiver distress, knowing that that conversation already has been had, that it has occurred, and that we are following the wishes of the patient. Next slide. And so thinking about this, as Aoife Lee takes over this presentation in the next slides, we really want you to keep in mind about who needs to know what matters to you. Think about who's part of your healthcare team, who is closest to you, who would you wish to be involved in your care if you were not able to have that conversation or needed assistance with making decisions. And also thinking about how will you communicate your wishes to others. Next slide, please. And this is what Aoife will discuss now.
Once I remember to unmute myself. Thank you, Magda. So you will possibly hear some of the similar type of things I'll be saying to what you've already just heard, but it's no harm to hear it twice and in two different voices. So the what matters, I tend to term in to sort of tune in on that as values-based healthcare decision making. And the three aspects that I like to look at are the values and know what is important to you. And that kind of relates to your living circumstances, your length of life, what is important to you in terms of your independence, in terms of what you're willing to put up with, what you're not willing to put up with. So we'll talk a little bit more about that, but it's values like that we're going to be looking at a little. And then, as you've already heard, the conversations are very important. As they said in my introduction, that I'm 20 years doing this, a little more than that, at Rush and Rush Oak Park. And I find that it's incremental. And particularly at Rush Oak Park as a community hospital, I've gotten to know people over the many years that I've worked there. And, you know, I get to know the kids and I get to know their parents. And then one parent dies and we have the next one. And so these conversations very much are incremental over the years in a community hospital particularly. But whatever, anyway. That likewise goes for your family and goes for your physicians. And then lastly, then we'll talk a little bit about communicating these decisions, these wishes, and the documents that go with that. Next, please, Jasmine. So behind all of this, what matters? I'm a young baby boomer, I think, or maybe I'm a middle baby boomer. And I came across a book in AARP some years ago called The Other Conversation. And it's kind of like a conversation that you've probably had with your kids when they started going into puberty and you had to tell them about the birds and the bees. Well, I think we as baby boomers and the great generation too, who are still with us, that we also have to have conversations with our children or our family members, our loved ones, the people who are close to us, and also with ourselves as what is the reality of my life now that I'm in my advanced years. Time will come. It's not if, it's when. I am less sharp or mobile or less able to engage and be the life of the party or whatever. I may have become an invalid in some shape or form, or I may have a greater incapacity to move and to do things like I would have done in the past. May have getting tired more easily. I'm sort of a little weary of life, and I've gone through a lot of things, and these things are our realities because we're not the spring chickens we used to be. And there's that realization that there is more time behind me than there is ahead of me. Um, I do not expect to live to be into my 120s or 130s. Though I know some generation might, but not me. So next slide, please. So values-based healthcare decision making is about how I want to live my life, what I have left of it, as fully as possible, up to the end of it, but also including that ending and how I want that ending to be. And that's what I'm going to talk a bit more about. So first of all, I'm going to ask you just to digest that reality, that our life is limited, and so how can we live as fully as possible in what time we have left, given our circumstance, given our health condition particularly. Next. So sitting with reality, what's important to me? You know, some people will choose to not buy their medication and choose to buy food because they can't afford both. Or some people will, choose to go on a vacation rather than buy a new car because experience is more important. We have different values and different things that we choose to do depending on those values. So one of the key ones that I've come across is our independence. And that is a sort of a core ethical principle of what we call autonomy in the ethical world. It's that independence. I am able to make decisions for myself. I'm able to live at home. I want to live at home. I don't want to live with any of my kids, or at least certainly not have to live with any of my kids. I don't want to put that burden on them. I don't want to be in an institution, or I do want to be in an institution because I know I'm going to be well cared for. So what does that look like for me? I have a dear friend who did make choices to change her living circumstances over the years as she got older. And now one of the things that she has said to me frequently in recent times, after she's had a few more health issues, and she's up in her late 80s, is that she feels very safe in the living institution that she is in now. And that's an important thing for her, to feel safe. There's somebody around. She can press a button, get help. That something breaks in her room, she can call somebody in to help, and she doesn't have to worry about things like that. Also very important to people is being able to help their children and their family. And again, going back to the idea of having the conversation about the birds and bees, it's to prepare our kids, to prepare the next generation. If you're a parent, I'm not a parent myself, I'm a good aunt though. But if you want not to leave, generally speaking anyway, we don't want to leave a mess or a problem behind us, especially for our kids. We want to help them to have things in order so that they should be able to spend their time and energy grieving the fact that we've died and not tearing their hair out because we've left a mess. So the more we prepare, the better, the more we're helping our kids. But before we die, there's also things we can do to help them as we decline in our health. Of course, our faith is very important. As a chaplain, we're trained to minister to people of all faiths, and indeed people who are not churched and maybe have little faith. But we all start to get some sense of what happens next once we've passed on. And how we face life with the sense of faith. Our faith can help us to access that inner strength we have that gets us over the hurdles that life has placed before us. And maybe the current hurdle will also help us get over. But there might be a hurdle eventually that's not ours to get over, rather it's ours to accept, and that's the hurdle of those end times, the end of our own times. I mean, our end of our own life. So we want also to try and have the values not be in conflict with one another, but be congruent. And again, we can go into a little bit of that. You can't say, I value my independence, I want to live at home, and then, but you can't get yourself up to the bathroom, so you can, and you've nobody there to help you. Uh, you won't be discharged from a hospital unless you're safe, going to a safe situation. Um, and that's often an area of conflict for people when they have to accept the fact that they have to go into some sort of supportive environment. Anyway, that's a detail. But those sort of realities could be facing us. And that's something it's better to talk about and think about before they actually happen. Next slide, please. So the conversations, talk to your family, your friends about these questions, these values, where you would draw the line is what I sometimes like to say. Where would you draw the line as to how much medical intervention you want to have? What are your family's values? Because sometimes we want to save our kids the trouble, or the family, to loved ones, the trouble of looking after us. But in reality, they want to look after us. They want us around, which is a nice thing. And so we have to kind of consider that as well. And sometimes people, we will do that. Not give up completely, because you're still loved, and our life will always have meaning. I was blessed to have an aunt who lived to be 98 and very with it right up to the end, very engaged. She was always interested in what was happening in your life and made you feel like you're the most important person. And that could be with one of her kids, one of her grandkids, one of her great grandchildren. Even if a little 4-year-old came over to her, she would absolutely give them all the time and leave even the child feeling, I'm very special. That's a great gift to have. And so nobody, even if they have to be looked after, we're still of great value. So anyway, but those values that I've speak about in terms of independence and all of that, they change as life changes. And so it is important to reflect on them in, regularly being, every, major birthday or whatever, or major life change, as to what now becomes important. Um, One of the times that is also good in terms of some of my comments are kind of general ones. It's the sort of thing we want to get our papers in order, so that if you can't get to the bank or get access your money, that one of your trusted family members is able to do that, so the bills can be paid. Practical things. But also in terms of healthcare, obviously we want to be constantly looking at what's happening with your health, reviewing that each year. How well are you doing? How well is are your conditions being managed? And what, how does that affect the decisions that you make? So having the time to talk with your physician at your annual wellness visit is a really good thing to do, and a good discipline. It's a little bit like making sure you've changed the batteries in your smoke detectors. You don't want it. You don't want to suddenly find you no battery in the smoke detector when the fire is already well underway. You want to change those batteries every year, I think is what they want us to do. And so the wellness visit is a good time to have these conversations with your physician, or with any major change in your own life. And then you'll see on this slide that there is a resource. There's many resources out there. Some of you may have heard of the 5 Wishes. That's a good website that gives conversation pieces as well, as is this patient priorities site is very good too. about helping us to think through our values and the consequences of those decisions. That's important too. Next slide, please. So, just to kind of put things in context from a hospital point of view, it is Illinois state law that when somebody is being admitted to the hospital, they're required to ask about advanced directives. And that advanced directives, I'm not sure if I have it on another slide, but advanced directives, the primary ones we were looking at is the power of attorney for healthcare and a living will, and maybe even a practitioner's order for life-sustaining treatment document. But then from a healthcare point of view, that they're the key ones. There are others as well, but they're the ones we're going to focus on. So when you're being admitted to the hospital, the law says, ask if you have one. If you haven't got one, the hospital is required to be able to give you something that will give you the information at least, and inform you of your rights and your responsibilities. So, and then there is a process within each hospital at Rush. Once you're given the documents, you can always ask for assistance in going through those documents. Quite frequently in the Rush system, that will generate a meeting with the chaplain, because we're talking about major life decisions in many ways, or we're looking at life, we're looking at values, we're looking at faith, we're looking at, you know, all of the other pieces that make up who we are. We're more than just more than our bodies and the blood that goes through our veins and all the different organs that keep us ticking over. So in some sense, the chaplains, as chaplains, we kind of address the whole person, all the body parts, plus the piece beyond us that is our own personalities and our characters and all that type of thing. And our connections, that's an important part. So next slide, please. So so I'm glad I have this slide in here, because advanced directive is a term we throw out very quickly. It's a kind of an umbrella term for many documents. All of these documents are ones that we sign as competent adults who are able to sign documents and able to read them, understand them, and say, yes, I agree with this and I sign it. And they're documents that we do in advance of something happening. So, so probably the one that we always think of is the will. We all want to make sure that our money goes where we want it to go. At least we hopefully want to do that, because that's a mess that you can leave people if you don't have a will in place. So we talk about doing a will. One of the other interesting ones, I had a patient, and not an older patient, it was a younger gentleman, but with health issues, many health issues, who did die suddenly in the hospital. And the only advanced directive of any sort that he had, that we knew about, he had actually signed up to be an organ donor. And when we discovered that, I thought, oh, this is interesting, because now it has actually taken some of the decisions that the family were struggling to try and figure out what to do, had taken it away, because he had signed up to be an organ donor. He was a viable organ donor, and Gift of Hope are in Illinois. Once somebody has signed up, it is law, even if the family don't like it. They are required to donate the body as is possible to the Gift of Hope for the sake of other people. And so that was an advanced directive that we don't normally think, I don't normally think of in the 20 years that I'm doing this. And I thought, oh, that's an interesting one. So remember, anything that we sign in advance is in preparation for an event that we think might happen. And hopefully the documents will reflect what my wishes and values are. They're not set in stone. It's something that can be changed. And it also can be changed as in who you appoint as your person to act on your behalf. And we'll go into that another little bit more. Next slide, please. So, as I said, there's the three that we're going to look at: the durable power of attorney for healthcare, the living will, and the practitioner's the provider's order for life-sustaining treatment, commonly referred to as a DNR, but it's much more than that. So, next slide, please. Oh, okay. So the durable power of attorney for healthcare is probably the key document that we would like people, everybody who's 18 and over, to actually get their hands on. You can Google it, Google Illinois, durable power of attorney for healthcare if you're living in Illinois. I guess if you're living in other states, get the one from your state, because the states, some of them differ a little bit. I'm obviously speaking from Illinois, and so I can address the state mostly. It's a document that as an adult we sign, and it says, and it does two things primarily. It gives the healthcare provider, the healthcare team, the sense of the authority to speak to somebody you have appointed as your spokesperson when you're not able to speak for yourself. That's the power of attorney, sometimes referred to as the agent in legal terms. So you get to name who is the person you trust to make decisions on your behalf when you're not able. When you're picking that person, you want to make sure that they can make hard decisions. It's easy to say it when, oh yeah, so and so, when you're well and when everything is going smoothly, but make sure you pick somebody who, when the going gets tough and hard decisions might need to be made, are able to do that. The other piece on this document is that you can name you can name substitutes. So sometimes I've come across people who say, well, I've got 3 kids and I don't want to pick one more than the other. And, we'll negotiate as to which one might be the actual power of attorney or the first agent. And there are substitutes that you can put on there. And it's good always, in my view, it's always good to have 2 or 3 folks on that document, just in case the first person can't be got in an emergency. There's always at least a second person and their telephone number and whatnot. So that's the first thing that this document does. You also can indicate your wishes, and I have that capitals because people look at that. The Rush has done a very nice job of sort of making the document more user friendly than maybe the Illinois one. It's a very legal document. But anyway, you can indicate your wishes. Generally speaking, there's 2 choices. It's either the quality of my life is more important than the length of it, or I want everything done to sustain my life, even if I'm in a persistent vegetative state. And being kept alive on machines, basically, and having to be in an institution. But it's an indication of your wishes. It's not a hard and fast document that therefore this is going to happen. It's a document that is allows the person whom you've named to negotiate on your behalf and to get access to your information to make healthcare decisions in keeping with your wishes, but also with in conversation with the physicians and the healthcare team, depending on what your reality is at that point. And so it allows your power of attorney to make those decisions. It gives them that authority. So the document is signed by a person who is an adult and able to do so. So we all have the capacity to do that. It's witnessed, and there's sort of certain people who can witness and certain people who cannot witness. It's more important that we don't choose the wrong witness, otherwise the document becomes more burdensome to use. But so that witness normally it's not your physician, it's not generally a nurse, and somebody who's looking after you, or even a family member. It's kind of a third party that you get to witness that. So sometimes people might do this in their community, in their church, and their pastor could witness it for them. You want to be sure that your power of attorney knows not only your wishes, but knows that you're appointing them as well. So don't sort of name somebody and not tell them that they're going to be it, because that also can be, that's not part of the conversation. I'm saying this all presupposing that you're going to have many conversations with this person about your wishes. And the good thing about this power of attorney for healthcare, it does not require a notary. You do not have to have an attorney to do this document. So that's why Rush can give you blank documents if you're coming into the hospital, you can get blank documents from the registration staff there. They have packets full of information around this, including the actual document. Next slide, please. The living will is another document that addresses your wishes, particularly at the end of life. It is a legal document too. Again, though, it is one that carries not only conversation, but an interpretation. Um, what I have found in my work is that sometimes folks go to an attorney and they will do their power of attorney for property so that they get their business affairs in order. And the attorney will just say, well, I can also do a power of attorney for healthcare and a living will. And you end up getting all these things done. And people think that they are DNR, that they are do not resuscitate, but the living will is not a DNR document. It is a document that indicates that if I am in a hospital and in a healthcare setting whereby there is an awful lot of interventions that could be done, I would not want them to do those interventions if I am dying. I do not want my life to be prolonged or extended. I want focus on comfort and on allowing death to happen, allow natural death to occur. That the phraseology is on the living will, the Illinois living will. But it's not a DNR. In practical terms, I have with the family, if I ask if you've got advanced directives and they say, oh yeah, we've got something at home and bring it in. Hopefully everybody listening after this, if you're going to do it, do your powers of attorney documents and many healthcare documents you do, you're going to bring a copy to your primary care physician. And if they're in Rush, they're going to be scanned into your Rush medical record, and then they'll be there for the healthcare teams to see. But if I find that somebody is in a life, is at end of life situation and they have a living will, I will help the family understand that actually means now the doctor needs to make the patient DNR, because that's their wish, not to, when their heart stops, their breathing stops, not to put tubes down their throat and not to do chest compressions and do all sorts of damage to the body as the person is passing away. So not to interrupt the process of dying, but rather to focus on it being peaceful and comfortable as possible. So next slide, please. And now we come to the practitioner's order for life-sustaining treatment. So this is a doctor's order. I want to make that clear that what's on the durable power of attorney for healthcare is an indication. You sign it, somebody witnesses it, and it's done. When it's a pulse document, that's practitioner's order for life-sustaining treatment, we call it pulsed. It is a document that the physician must eventually sign it as well. So you sign it, your power of attorney or your power of attorney signs it, and somebody witnesses it, and the doctor or the provider must witnesses, the doctor's representative must also sign that document to make it a doctor's order. And I say that because it's primarily for when you leave the hospital and you're at home, and if 911 is called, the ambulance people, the EMS, are obliged to try and bring you back unless they see this document complete and this order from the doctor. So you kind of think of it in that regard as a doctor's order to other healthcare teams not to do aggressive interventions. It is more than, and again, Google pulsed Illinois and it'll pull the whole document up. But it's more than just saying do not resuscitate, though that's the primary purpose of the document because it's an emergency order. It's in the case of you being found unresponsive and no pulse. No pulse, and your heart has stopped, oxygenation to your brain has been interrupted, and you are effectively, you have died, then you're not to be resuscitated, be brought back to life. And so that you're setting clear limitations as to the aggressiveness of medical interventions. Does not mean that if you've fallen and fractured your hip and you're, even if you're unconscious, but as long as you've got a pulse, the EMS are going to do everything to get you together and bring you to the hospital, and we'll do everything to try and help you recover. But the other parts in this is more for an indication again of decisions should your health be failing. And one of the ones that I find probably there's two sections to it. And one where it talks about tube feeding and things like that. And it's clear if you have a stroke, you haven't died. However, you may not be able to eat again. And depending on other circumstances, would you want a feeding tube placed? And, you know, what the consequences of that and what's involved in that. And that's not a fix, a cure. It's not a permanent fix for anything. Because at the end of the day, there's no permanent fix for life ends at some point, and we will all go on to whatever comes next. We will all go on to it at some point, and so there's no fixing everything. We can try and make it as best we can. So again, these documents, if you did do a physician's order for life-sustaining treatment document, you can either do it in the outpatient setting with your primary care physician. You can do it in the hospital. You're going to, in the hospital, you're going to find you'll get a purple wristband so that the whole healthcare team knows that should you have a decline rapidly and pass away, we're not going to do everything. And the important part of this document is that it goes with you, and that you have a copy of it in your person, and that you have it at home and available. And if you do this document elsewhere, that again, this document is brought to your physicians. I've had people say, oh, I think I have those documents all right. I think they're in the safe deposit box at the bank. No, do not, you put the original documents there, but make sure all healthcare documents, a copy of it, are given to your physicians, and not put in a vault that is not accessible. But we all put important things away in a safe place, and forget that sometimes they need to be accessed in a hurry. Anyway, next document, next slide, please. So when should the conversation occur? Well, anytime is always the right time. You know, when something major happens, we're going to have a major surgery. If you're, you know, if you've lost somebody who's significant to you, then, you know, that often prompts the conversation and prompts the sense of reflecting on getting, you know, getting my own affairs in order when we've had a sudden life change. The documents you can do now it doesn't mean you cannot change them in the future. You can, and you should revisit them, if not annually, certainly after every few years. You know, as I say, after a major thing. I can tell you that in Rush Records, I've pulled up, and we look and see who's the next of kin and who's the main person. And I've looked at it and I said, but he died last year, or 5 years ago, or whatever, you know, and so they do have to be reviewed regularly, especially as we get older and as things change in our lives. So again, we come back to that annual wellness visit. That's when I would hope that your doctor will say to you, is your power of attorney still the same? And remember too that if you know, another common one I come across is a spouse, and one is in better health than the other, and they're each the other's power of attorney, and then you suddenly realize that they are uh, that the other person is beginning to their health is beginning to fail, and so you want to make sure that you have somebody who is healthy who is going to be your power of attorney. So next slide, and it looks like we might be going back to Magda. So next slide.
It just froze once again, so let's try again.
Yeah. Oh.
All right.
Okay. I think I did do one of your slides.
There we go.
Okay.
Does this look right?
Yes, it does. Thank you.
Okay, great.
So for those who are familiar with the annual wellness visit, you might have already noticed that this visit is different than the typical routine medical visit that you will have with your healthcare professional. This is an annual wellness visit that for those who are Medicare enrollees is covered annually. It is free. So the annual wellness visit portion is covered by Medicare at 100%. It can sometimes be paired with a medical visit, the traditional visit that you have with your physician. So just be aware that it could be combined or it could be done separately, but that the annual wellness visit portion is free. And it is an opportunity that at least once a year, all of the routine preventative healthcare items are reviewed with your physician or the nurse practitioner or the physician assistant who is guiding your care. This is an opportunity to make sure your vaccinations are up to date, that you receive a dedicated screen looking to address any dental, vision, and oral and hearing and oral health issues that might come, or even looking at food security. This is also an opportunity to receive a cognitive screen. We know that many older adults live with undiagnosed cognitive impairment or even early stage dementia. So being able to catch any signs of any changes in our cognitive functioning early on is important. It is an opportunity to take a closer look at the medications that you are taking and making sure that it still makes sense to continue them. And most importantly, given the fact that we're having this conversation, this is really an opportunity to have that conversation with your clinical healthcare team, to talk about whether you've ever had completed a healthcare power of attorney document or that advanced care directive, to make sure that anyone who is involved in your future health understands and is able to respect your wishes in regards to your overall health and well-being. And so this is that opportunity to have that time to really sit down and think about what's important in that event and to be able to document it. This is not a visit where your healthcare professional will do a full head-to-toe physical exam. That's a different type of a visit. So this is really an opportunity to have a good conversation with your provider and just really go over all of the things that are still important to your health, but might not necessarily be addressed during these routine visits that typically are very short in time and seem to really mostly focus on making sure that your acute and chronic medical conditions are addressed. Next slide. And so this is a little bit of a different checklist just to show you the difference between that physical medical visit versus that annual wellness visit. I can share that when my clinic at Senior Care initially started trying to really highlight the importance of these annual wellness visits, we had many patients who were giving us feedback, well, my doctor doesn't listen to my heart, they didn't listen to my lungs, they didn't check my feet. This really wasn't a visit. And we had to provide a lot of education to say, you did have a visit, just the nature and the purpose of this visit is very different. And you really do want to have that different type of a visit because, again, it's an opportunity to really sit down and speak with the person who is in charge of your health care to make sure that they understand what's important to you, what are your concerns. Perhaps there are opportunities to address things that have not been addressed during routine medical visits that still need to be addressed. And to really have that conversation to say, hey, I need to update my wishes and my preferences, or I understand that my health is changing. I really would like to talk about what the best case and the worst case scenario would be and make sure that it is documented for everyone to know, and then go back to my family, especially that person or persons that I have chosen to be my power of attorneys for my health care so that they understand my preferences too. Next slide.
Magda, this is such a great slide and image right here. Would you be able to read this for those who've joined in over the phone?
Sure. So the annual wellness visit is really a review of your medical history. We look at risk factors for illness. So we do that healthcare risk assessment screen. Like I mentioned, it looks at food security, it looks at function, vision, dental, and hearing. We know how important addressing these things and can be, but very often during a routine medical visit, it's not something that we generally focus in on because we're trying to manage diabetes, high blood pressure, COPD or asthma, or other chronic medical conditions. It is an opportunity to have that review of our medicines that we are taking, vaccinations, and most importantly, our advanced care directives and our power of attorney. And at the end of the visit, you really should be able to receive a personalized plan as a printout after that visit, seeing what has been done and what else needs to be done as part of your annual visit. Next slide.
Thank you, Magda. I'm going to need to get out and try this again. All right.
And so I just wanted to highlight the resources that are available at Rush, and especially for any older adults and families that receive their care at Rush. Feel free to actually share this with your friends and family, even if they are not Rush patients, because this is really a great resource in helping to answer common questions about common medical problems that older adults may face. Next slide. And so this is the catchon.org website. As part of the website, the catchon.org, we also have the 4M resources. So remember, the 4Ms are what helps us become an age-friendly health system in addressing the what matters, medication, mentation, and mobility for older adults. Those of you who can see this slide, the top resource is actually about what matters. So there are several different links for patients and families that can review advanced care directives, the patient's priority care website that was mentioned during the presentation earlier, and a couple different other links that are pertinent to this presentation. Next slide. And for those of you who might have a harder time just finding the 4M's resources through the catch-on, we provided a link to the post, so the advanced care directive form that the physicians will sign with the patient, 4M resources as part of the age-friendly health system, and also the patient priorities care website, which is definitely very useful in terms of initiating and having individuals start thinking about what's important to them. And as their health changes, what are the potential trade-offs that they might need to make in order to still maintain a good quality of life, but understanding that things have changed in terms of their overall health. It is a really great resource that can help start us thinking about, again, what matters to ourselves on a personal level. This is the end of the presentation. Thank you, everyone, for listening. I think we might have a couple minutes if there's any questions. I'm not sure if this is the right forum to do it, but Chaplain Ify Lee and I are still available, I guess, to answer any questions that you may have.
This is great. Thank you both so much. That was so informative. Really good to start with the 4Ms and see how that's all connected and how to approach this. So thank you so much. We're going to go ahead and move on to the Q&A portion. So we have a few questions already. Before I ask those, for anyone who's joined in over the phone, you can unmute yourself now and ask a question. And to unmute yourself, you can press *67. All right, so we'll move on to our other questions. And for those of you over the phone, after I read these questions, then we'll have another opportunity for you to unmute yourself and ask a question if you think of one then. Okay, first question. What's the first step in completing an advance directive?
The first step, I guess, is really to make sure you have a blank copy of the particular advance directive you want. So you want to go and look for the Illinois Durable Power of Attorney for Healthcare. For instance, that would be where I would start. So get a blank copy, read it carefully, and then start talking to your family members about it and about that would be the first step. Get a blank copy, read it, and start talking. I guess that's 3 steps.
That is actually a perfect segue into the next question, which is how do you manage getting a power of attorney in place when your family doesn't want to think about it?
Yes, that is a hard one. So I think what I would do is, you know, leave aside, don't worry so much about documents at this point. Begin to talk about life with your family, even if it's, you know, talk about whatever life experiences they've had, you've had. Reflect about your own parents or your own older generation, or just reflect with your family about, what it meant to you when such and such a thing happened to somebody in the older generation. So that is, if you share your own experience with your loved ones, they can't argue about it with you. Well, they can try, but hopefully they won't. But it's not that you're asking them to do anything, but you're preparing them. And I guess that's will be the way, to sort of just do it all very gently, but share your own experience. It is always a good starting place.
I agree. I think that we can never estimate the importance of being prepared. And so this is really a great way that just as we have planned for major events in our lives, whether it is that we've saved up for college, right, or we've saved up for retirement, or there's a big vacation that everyone's looking forward to, right, that requires planning and research and taking the time to think about what it is that's important to us, right? And so just as we think about those important life decisions, this is also one of those decisions that we have to make. And it can, for some of our family members, be a scary thought, right? That, I don't ever want to face the situation where I'm losing my mom, my dad, my grandma, right? Someone incredibly close to us. Because that's a very scary and sad thought. That's very natural. That fear is normal. It means that very much they love and care for you. But part of the way that we can return that love and care is to try to prepare them for a time where they might be having to face that difficult decision. And so the fact that we are sharing what's important to us is really a great gift, because we can understand how painful and how difficult having to make the decision can be. And so if we can provide them with some guidance to let them know what's important to us and give them that comfort and that confidence that they are carrying out our wishes and this is what we would want for ourselves, I think can sort of help at least give them the comfort that they are trying to honor you and what's important to you.
So beautifully said, both of you. Thank you. We have a couple more questions. And after that, again, for those of you over the phone, we have the opportunity for you to unmute yourself too. The next question, can you change your documents? If so, when is the latest that you can make a change? Let me know if you'd like me to repeat it.
I've got the question. Yes, you can. When the durable power of attorney for healthcare and even the Pulse document, you can change them pretty much at any time. So you what's hard is you don't want to make a change in suddenly. So you want, that's why it's important to constantly review, constantly talk. And it's you don't want to, it's not like you don't want a knee-jerk reaction. But if you truly have fallen out with the person that you had named, or they have lost the capacity to make decisions, or for whatever reason, that now this person that you took the time to thoughtfully appoint as your power of attorney is no longer the suitable person for the position, then then you can change it. Obviously, if something sudden happens, then something sudden happens and you can change it. But remember, it's not hopefully all of this is something that is being able to, you can time to think through it and then make a decision to change something. But yes, you can. And how you change it is by updating the document. And then making sure that the person that you have now appointed has a current copy. You date it, of course, and you bring that to your doctor's office, or it goes with you. And it's, so the current document is the one. When you read through the document, you'll see that language is there. It's like the will. I revoke all other wills other than this is the one now I want. So, but it can be done, and it can be done fairly easily, because it's not, you don't need an attorney to do the power of attorney for healthcare. So it's nor a notary. So it's a little easier to update that document and change it.
Thank you. The last question.
Sorry, go ahead. Just as a reminder, I didn't say this in my presentation, but yeah, I've emphasized giving a copy of your healthcare documents to your healthcare team, your physician. That's important. But it's also important that the person you name has a copy of that, and indeed other family members that are as appropriate. But so you can make multiple copies of your current document and make sure the right people have it.
And in fact, generally, we recommend that patients keep a copy of their advanced care document actually on their refrigerator or in their bedside table, something that family members know that this is where the important information is stored, so that in the event of a medical illness, an emergency, someone can easily just grab that packet and all of that information is with you.
All right. The last question we have, what about for caregivers caring for a family member with early to mid-stage dementia? How can family members help the family member with dementia complete a POA?
That is a wonderful question. One of the reasons why it's so important to diagnose early stage dementia or even mild cognitive impairment is that it really allows that opportunity for the patient and their family to start planning for the future. It can involve conversations such as who's going to manage my finances when I no longer can? What will my living situation be like? And also in terms of our end-of-life wishes and healthcare wishes towards our even general health, what is it that's important to us? Generally speaking, even patients who have more advanced dementia, when we talk about stages, early, moderate, or severe stage, sometimes even in the moderate stage, patients are able to express a preference. The concept of capacity to make important decisions is a different conversation all by itself. But what I will say is that capacity to make those decisions is situational and time specific. And also, as someone who generally knows their family member, they really are looking for consistency. Hopefully, this patient has already had some maybe general, maybe not as specific conversations that they might have expressed their wishes before, where they said, and May was in the hospital before, and she was in the ICU for a very long time. It seemed like she just really seemed to suffer. This is not something that I would want for ourselves. Some family members do that, right? They talk about that. Some end up being very private, and we might end up having to initiate that conversation. But sometimes searching for those clues, or even saying, mom was never the type of a person who ran to the doctor, who was very engaged in getting every single test that was recommended, or even just wanting to go in and get checked out. She was very hands-off, not really wanting to engage with the healthcare system. So even sometimes these kinds of behaviors can provide a little bit of insight in terms of what might have been the patient's preference in a specific situation. Ultimately, what we are looking at is when patients cannot make those decisions, they have not expressed their choices, the person that's closest to them and is in this position to make those decisions for them, we're looking for substituted judgment, thinking about what you know about the patient, what do you think that they would have made that choice? So this is a roundabout way of answering the original question. Is it, can a patient with early and moderate stage dementia still participate in assigning a healthcare power of attorney or even talking about advanced care directives? The answer is yes, but it depends. So at that time, what I would probably say, it's a good idea to even involve the physician who's leading the patient's care, and just saying, hey, this is something that we've been thinking about. We'd like to have a visit to discuss this. And does it seem, in your opinion, that mom is able, or dad, or someone else that you have the honor of being that caregiver for, to say, can they make those decisions? Can we have a conversation about it? Does this seem reasonable right now? And ultimately, the things that we want to happen is, when you have time, when it's not an emergency, you are not faced in a situation where time is of essence, this is the best time to have those conversations. If we have a large family with multiple children involved, and it might be hard to get everyone together, but it so happens that everyone gets together on the holidays, that might be that time to have that conversation, because more people are together. It tends to be a more family-oriented event where you can have that conversation.
Thank you. And as soon as I said last question, we got more questions coming in. And so I think that speaks to just how important this topic is. So the next question that we have, I think, Magda, this is for you. Why do we have to have two different annual visits? Can't the two be combined? Because Medicare will only pay for the annual wellness visit. We will have to pay for the annual physical exam.
So the annual physical exam is a welcome to Medicare visit, from what I understand. I don't want to muddy the waters too much about this. So as I mentioned, you can have that physical exam visit that's covered by Medicare as a physical exam when you are first enrolling into Medicare, sort of as the fact that you've enrolled and it says, welcome to Medicare, congratulations, you're an older adult, you get Medicare benefits. But that annual wellness visit that we just mentioned, it's very much a non-medical visit from the traditional sense. It doesn't involve a physical exam. It doesn't involve usually ordering too many labs. Sometimes it might be appropriate depending on your healthcare maintenance orders. There are very specific things that will get covered as part of that visit. But again, it's not meant to be that routine medical visit that addresses chronic medical problems.
Thank you. Okay, the next question, could someone get help with this while on a hospital admission?
Yes. Yes, they can. With this being, I assume they mean with completing a power of attorney for healthcare. Yes, even in same-day surgery, sometimes we get called to go down and talk to somebody because they want to make sure that if something went awry, that the person that they want to name is knows what's what and has the authority to make decisions. So yes, it can be.
To echo Ify's comment, absolutely. As someone who sees patients in the hospital or in the skilled rehab setting, very frequently I find myself having these conversations with patients and their caregivers or their surrogate decision makers, because we end up realizing through either our conversations or through a chart review that the patients have never really completed an advanced care directive or healthcare power of attorney. And again, while this is an opportunity to complete it, ultimately we would love to see these documents completed before someone ends up in the hospital. Because we recognize how important it is to have these documents, we continue doing this during the hospital admission, but ultimately we would love to see the vast majority of them to be done in the outpatient setting. Usually what ends up happening is that it's sort of reality hits when someone gets hospitalized and they realize the importance of having these documents. Then they say, okay, we should have it done, let's do it. But ultimately we would love to see more of them happening in the outpatient setting.
Absolutely. I can tell you the more you are prepared with these conversations, with the documents, the easier it is on your loved ones. And as Jasmine in my introduction was, for 20 years I've been doing these conversations in the ICU. And the recommendations across all of the research is that the conversations should happen as far away from the ICU as possible, and preferably at the dinner table at home. And then you follow through with your healthcare providers. But so hopefully all of you who are listening know that you're going to do it way sooner than at the when everybody is under stress. It's not the best time to do anything.
Great way to explain that. The last question we have, and you are getting some thank yous as well. The last question we have online is, where can I locate an advanced directive form?
Well, the some of the resources that are at the end of the presentation that we referred to, either on Rush Generations, have links to the to the Rush prepared documents, which are all compliant with Illinois state law, with the Illinois documents. They're actually, the great thing with the Rush is that they have them in multiple languages. You can have it in English, Spanish, Polish, and I think Mandarin. I'm not 100% sure if it's Mandarin, which major Chinese language, but the simplest way is good old Google. I've no affiliation with Google or any of those things that we're supposed to make disclaimers about. But Google the term, and as I say, your state and the durable power of attorney, and that will bring up the document as well. And certainly it has it in English and Spanish. So that's the simplest way of getting the document.
Wonderful. All right, and before we wrap up, I just want to give one more opportunity for those of you who've joined in over the phone. If you had any questions or comments for our speaker, you can unmute yourself now. And again, to unmute yourself, you just have to press *67. All right. Looks like that was all of our questions. Thank you both so much for sharing all of this information, for patiently asking and answering all these questions. We really appreciate you both. For everyone who's still here, thank you. We're going to go ahead and share some of our upcoming programs. All right, here we go. Okay. So first we have our Learning to Live Well with Chronic Pain program. So this will be on Thursdays from July 29th until September 9th from 1 to 3:30 p.m. Now this program, as well as all the programs we're about to mention, are all taking place virtually, which just means through the computer. Some of them will be over the phone. So we're not meeting in person yet. So again, this is our workshop, Learning to Live Well with Chronic Pain, Thursdays from July 29th until September 9th from 1 to 3:30 p.m. This will be taking place through Zoom. And so if you are interested in this program, but you're not sure how to use Zoom, that's okay. You can go ahead and give us a call if you want to register, and then we'll make sure that a member of the team helps you get acclimated with Zoom before it starts. And so if you're interested in registering for this program, you can call the Rush Generations number, which is 800-757-0202. Next, we have the Take Charge of Your Health workshop. So this is also another workshop that's 6 weeks. That's all about learning how to take better care of our health and manage our chronic conditions. This will be on Mondays from August 9th until September 20th from 2 to 4:30 p.m. Again, this will also be taking place through Zoom, and you can call the Rush Generations number for this program, as well as all the programs I'm about to say. And that number is 800-757-0202. Next, we have A Matter of Balance. So this is a workshop that's all about learning how to prevent falls, and it also addresses the fear of falling. It's a really great program. It's on Tuesdays and Thursdays from August 3rd to August 31st from 1 to 3 p.m. This, again, will also be taking place through Zoom, and you can call the Rush Generations number to sign up or to learn more. Next, we have our Health Legacy program for women. So first, we have the Health Legacy program in English. This will be on Mondays and Wednesdays from July 21st until September 1st. This is from 4 to 6 p.m. And the Health Legacy program is for women, and it's about taking care of our health, not only for ourselves, but also thinking about the legacy we'll leave for future generations as well. So you learn about healthy eating and exercise and all of these different aspects that help to take care of yourself and your wellness. So it's really a wonderful program. And so the Health Legacy program for women in English will be on Mondays and Wednesdays, July 21st to September 1st, 4 to 6 p.m. And then we have the Health Legacy Program for Women in Spanish. So this one will be on Tuesdays and Thursdays from July 26th to September 9th. And that is from 3 to 5 p.m. And so this one has started, but if you are interested in registering, there's still a time. So again, for this program, Tuesdays and Thursdays, July 26th to September 9th, 3 to 5 p.m. Health Legacy Program in Spanish. And if you want to register, you can call 800-757-0202. Next, we have our Coping and Connection in the Time of COVID support group. This is a great program. This happens telephonically, so over the phone, the third Wednesday of every month from 3 to 4 p.m. So this is an opportunity for you to get on the phone and speak with other individuals as well as one of our social workers to talk about some of the stresses and the realities of living through this time of COVID. We know that things are always changing, there's new information, so it's a really great time to process and talk about those concerns. So again, the Coping and Connection in the Time of COVID support group is the third Wednesday of every month from 3 to 4 p.m. Now we have the number and the access code up for those of you who are joining online, but also you can get this information by calling the Rush Generations number. All right, we also have our diabetes education and support group. This is the third Thursday of every month from 2 to 3 p.m. And just like how it sounds, it's a really great opportunity to learn more and also get that support from other individuals who have experiences with diabetes as well. We also have our Senior Connections Friendly Caller program. So if you're interested in receiving a call from a volunteer once a week for friendly conversation, this is a really great program for you. If you're interested in this, you can call the Rush Generations number, again, 800-757-0202, and then they'll match you with a volunteer. And you can pick a day that works best for you, a day and a time, and then you'll be able to receive that call from a volunteer and set up that schedule just for some friendly conversation and connection, which is so important, especially now, as we may be staying home and spending some less time being social. This is a really great program. We also have our Rush Caregiver Initiative. So if you're a caregiver or if you have a caregiver, this is a really great program to consider. It offers education and support to family caregivers of individuals who are 65 and older. So if you're caring for someone who's 65 and older, or if you're 65 and older and you have someone caring for you, this is a great program for them. So the program starts with an assessment, and then they'll come up with a really customized approach to figure out what's needed and how to support you the best. So if you'd like more information and you're interested in the Rush Caregiver Initiative, you can call the Caregiver Initiative at 312-563-0350. And I'll repeat that again. It's 312-563-0350. And lastly, we have our Shaman Senior Voices program. So Shaman Senior Voices is all about learning what matters most to you. So this is one of the 4 M's that Dr. Bednarczyk had talked about, learning what matters and how that's so important because that's a piece of all the other M's as well and really a part of everything that we do. So first and foremost, if you visit our Shaman Senior Voices website, which is aging.rush.edu/Shaman. I'll put that link in the chat. Over there, you can view some of the videos that we have collected. We have videos from older adults all around Chicago. We also have videos from our healthcare students talking about why it's important to learn what matters from older adults. It's a really great opportunity, especially now, to just dive through the website, look at different interviews and videos that are there so far. You may even be on there if you've recorded a video in the past. We have a number of Rush Generations members who have. And if you're interested in recording a video, you can do that from home. So if you'd like to answer the question of what matters most to you, you can visit bit.ly/Shaman youtube.com/recordmystory. And the record my story, R, M, and S are capitalized. So if you go to that website, you can also take your phone and open up the camera and point it at the QR code over there. So that's that funny looking symbol, the square over there. It'll also take you to the website. So if you go to the website, you also have the opportunity to record on the spot and share what matters to you as you age. And what we do with these videos is we like to have these conversations about aging out in the community. And also we teach our healthcare students about what matters. And also we learn from these videos about what are these themes, what are we learning is most important as we age, and we use that to then develop programs and figure out what gaps are there. So we really do value your perspective and your input, and we hope to learn from you. And if you have questions about that, if you're interested, but you are hesitant or have some questions, please feel free to give me a call as well. The number is 312-942-6995. And just a final reminder that Rush Generations is here during this time that we're all at home. We still have a number of programs over the phone or on the computer that you can get involved in to stay connected, stay healthy, stay social. So if you are interested in any of these programs, needed some more information, or if you want to become a Rush Generations member so you can get updated on upcoming events and things like that, you can call Rush Generations at 800-757-0202. We also have a Rush Generations Facebook page that you can visit where we update our upcoming events there as well. Thank you again, everyone, for attending. We're really grateful to have had you, and we look forward to seeing you at the next slide.